HPV test. Your cervix is the lower part of the uterus, at the top of your vagina. A Pap test is used to check your cervix for abnormal cells. Abnormal cells can sometimes turn into cervical cancer if they aren't treated. In some cases, your cells may also be tested for infection from a virus called the human papillomavirus, or HPV. HPV causes most cervical cancer, as well as genital warts. The collection of cells for both tests can be done during a pelvic exam. First, your healthcare provider will place an instrument called a speculum into your vagina. The speculum will be opened so that your cervix can be seen. Next, your practitioner will use a scraper or brush to gently collect cells from your cervix. Your cells will be examined under a microscope at a lab to see if any of them are abnormal. The lab may also test your cells to see if they show signs of HPV infection. It usually takes about 1 to 3 weeks to get your test results.
Or cervical dysplasia. These morphological changes can range from mild to severe. If the results are abnormal, the test is repeated again after 6 months or a year to monitor the condition. Additional diagnostic tests may also be performed. In most cases, mild dysplasia resolves on its own, and a follow-up Pap test is all that is required to confirm. In a small number of cases, these abnormal cells may develop into cancer, but they usually take years to do so, which allows plenty of time for treatment when detected early. In the US, a Pap test is recommended every 3 years from the age of 21, or every 5 years if combined with an HPV test. Treatment options for cervical cancer include surgery, radiation, chemotherapy, or a combination of these. Early-stage cervical cancer is typically treated with surgical removal of the uterus. This option is the most effective in preventing cancer from coming back and is usually preferred when patients do not need to maintain fertility.